I've been an abdominal radiologist for many years and in the academic setting primarily, although also in the private practice world for many years as well. And really have had the pleasure of over the last 2 decades, really seeing the growth in abdominal imaging and prostate cancer imaging especially. A big part of that has been the optimization of diffusion-weighted imaging techniques. Over the last 10 years, there's been really a massive growth in using imaging to characterize, detect, even screen, increasingly in asymptomatic individuals, healthy individuals, for prostate cancer. And as we think about cancer screening in general, and especially prostate cancer screening, the recent PRIME trial showed rough equivalence between full multiparametric MR and biparametric MR without contrast. A big part of that is diffusion-weighted imaging. So I think where goes diffusion-weighted imaging goes high-quality, accurate screening. I really think of restriction spectrum imaging, and Cortex now has an FDA-approved product called OnQ Prostate, which is really the commercialized version of that, as a better mousetrap, a better diffusion mousetrap. And restriction spectrum imaging, I think, more than incrementally improves on traditional diffusion-weighted imaging. But really the whole idea is that, like any imaging technique, diffusion-weighted imaging has background noise that we'd just rather not deal with as radiologists. So really what restriction spectrum imaging does really attenuates and mitigates all the noise that we don't care about. So it mitigates the signal from hindered water, mitigates the signal from anisotropic water, anisotropic diffusion, and really allows the viewer, the radiologist, to look at the volume fraction of spherically restricted water, which is the water that we see in most cancer cells. There's increased conspicuity, better contrast to noise, depending on the scanner type, also better spatial resolution. But I think one of the major advantages is, as we think about a world in which AI is helping radiologists, in that regard, RSI or OnQ Prostate is an excellent partner for the radiologist. It can help an experienced reader like myself, and in practices where maybe the reader doesn't have decades and decades worth of experience reading prostate MR. So really just think about it as a multi-B, multi-directional diffusion sequence. And so in that respect, it's a very short 5-minute pulse sequence, and it can be readily integrated with T2 fast spin echo, turbo spin echo. So it really doesn't add time to a traditional prostate MR scan. Increasingly, radiologists are really working hand in hand with our clinical partners. Many of the urologists that I practice with actually review the images themselves and with their patients. And so I think in a way, what RSI can do is sort of de-skill the MR. The RSI map is positive contrast. So the signal, the prostate cancer signal, will really light up like a light bulb. And it's very conspicuous and very easy to see, even for the inexperienced reader, urologist, or patient for that matter. So I think it just allows for better conveyance of the findings to everyone that's included in the conversation.